and welcome back to my channel, Not Your Average Sex Talk. Today we'll be talking about condoms. Condoms are a type of contraceptive or birth control. I have some here, just simple Trojan ones. Sorry for the paper in the background. I have a bunch of pictures and stuff hung up on my desk, so I'm trying to put a paper there. Hopefully it'll only focus on the main items in front that way. So condoms look something like this. Basically what they do is they prevent pregnancy, and they also prevent STIs or STDs if you come in contact with any. So these are what they look like. These are just standard Trojan ones. This one is a little deflated. You can't tell so much, but it doesn't really pass the pillow test. There's no pillowiness here, no air in it. Whereas this one definitely passes the pillow test. It's just been sitting on my nightstand. This one has been out in the heat, and condoms that are out in the heat tend to melt a little more. It's still a little pillowy, so I think it's still good. You can tell that there's still air in it. But if it doesn't pass the pillow test and it's flat, there's no air in it, you don't want to use that condom, because that means that there has been a hole punctured somewhere in this wrapper here. I'm going to see if I can puncture a hole in it for you so that you can see what I'm talking about. Okay, I punctured a hole in it. Now you can see there's no air in it at all. I can't, no air. Just the condom. You don't want to use a condom that hasn't passed this pillow test where there's no air in it, because if something has punctured the outside wrapper, that means that it could have punctured the condom inside. And if the condom inside is punctured, sperm can get through that puncture. Condoms are a barrier, but sperm is very, very tiny and will get through holes. And if a condom breaks or a condom is weak, it's not performing its best, there is a possibility that sperm will get through it. So another way that we have to check here, my bad, I have that upside down. On the back of the condom, it'll say EXP, and then a date. That date is your expiration date, and if the condom is past that date, you cannot use it. That means that this condom will not perform as effectively as it should. So you can see this one here says 2026. We are in 2022. Perfectly fine to use. So for demonstration purposes, like I said, I have two condoms here. This one passes all the tests, this one doesn't. So you'll want to use this condom because this condom passes all the tests. So let's assume this condom has been outside or in somebody's wallet. It has been sitting in someone's car. That is not a good sign. If it has been sitting in somebody's car or in their wallet, it will have created a lot of friction, it will have been in a bunch of heat, and it will not perform as well. Silicone will melt and break down with those kind of things. Okay. So, next on the list here, we have lube. Lube is pretty important, especially if it's somebody's first time or if you're not having penis and vagina sex. Lube, something like this, will work perfectly fine. It is just, again, I got it at Rite Aid or something. But you'll want to get something that says water-based, or I don't remember what the other one is, but you don't want to get oil-based. Oil-based lubes will break down the condom. So a water-based one is always good to use. It's pretty compatible with everything. You can see on the bottom here, condom compatible. So yeah, if it says water-based, you're good to do anything with it. You can have sex with the condom, you can do other things, but the condom will not break down. Oil-based lubes will break down a condom. Okay, so I have my demonstration here. Here's our condom. So another big thing about condoms is you don't want to tear this wrapper with your teeth or cut it open. It's paper. You can just rip it open. It's not that difficult. If you break it open with your teeth or with scissors, you have a possibility of cutting the condom or tearing the condom, which again will make it so that the condom cannot prevent sperm and fluids. So we take this condom out. Most condoms are pre-lubricated, but it's not necessarily always enough lubrication. You can see here, we actually have the condom on the wrong side right now. So you want it to not look like a beanie. You want it to look like a little sombrero hat. You'll know if it's on the right side or not because it'll roll down easily. You then take the penis or whatever you are applying the condom to. You don't want to just straight put it down. You want to pinch the tip of the condom, this little like nub here at the top. This little nub kind of looks like the nipple of a bottle. You want to pinch that because that is where your sperm is going to go. If you don't pinch that, you don't have any space for the sperm to go, then the condom can pop. So we take the condom and you roll it down. Just like that. And see, you have a little bit at the top for the sperm to go into, and you roll the condom all the way down. There are different types and sizes of condoms. It's all up to preference. Buy whatever you want. Size of condom can make it more comfortable for the person who is wearing it. But you should always wear a condom, and there will always be a condom that will fit. Now that we have the condom on the penis, this is when you could apply your lubricant to the penis or to the other area. So to remove the condom, all the sperm will be up here. You'll want to, this is much easier on an actual penis. This is very rigid. You'll want to kind of take the base of the condom here, you see, and sort of roll it up and roll the penis out. So typically it won't turn inside out like that because it'll be on a real person. And you'll have the condom look like this, and there will be the fluids at the bottom. You can take the condom and tie it off at the end. There won't really be anything on the end, so you can just tie it off and throw it in the trash. You don't want to flush this down the toilet. It'll ruin your pipes. If you want to kind of be secretive about it, I recommend rolling it up in toilet paper, kind of like how you would do a menstrual product if you don't want anybody to view that. So that is how you dispose of condom. If you are having any type of oral sex or non-penile sex, you can also use a condom to prevent from STDs. And let me show you how. This is when you will actually go against everything I have said previously and will be tearing into the condom, basically. So you'll take your condom, you'll take a pair of scissors, I don't know if you can see, and you will cut down one side of the condom. And then you can open it up like so, and you can stretch out this barrier over wherever you are going to perform oral sex that isn't on a penis. So vagina, anus, anything like that. You can stretch this over the area and then continue to have oral sex. These are called dental dams. You can buy dental dams, but they're not very accessible. They're very hard to obtain. The reason somebody would want to use a dental dam is to prevent STIs. Obviously, if you are having oral sex, you cannot get pregnant because there is no sperm entering into an area where it could have access to the uterus. But it could cause you to have STIs, so a dental dam is good to prevent it. So is a condom. If you're having oral sex with a penis, you could just put the condom on and have oral sex as usual. That way, no fluid comes into contact with your mouth or other areas of your body. You can also use dental dams as a barrier if you aren't having oral sex. You can use it as any sort of barrier where you would prevent fluids from being shared. So yeah, that is my demonstration of a condom. It is a type of birth control. It's called a contraceptive, and it is very effective if used correctly. So that is how you use one. That is how you use it correctly. Please be safe, and I will see you guys next video. Bye-bye.